Communications. With the public, a emergency means, as the situation permits and subject to emergency powers of the director, all existing means of communications not required to support military operations will be used. Per Canalrad, prior to the invocation of Canalrad, civil authorities will use all broadcasting facilities, AM and FM radio and television, and all emergency means to give emergency instructions and information. Canalrad, the commander of NORAD, is responsible for ordering the radio alert which puts the Canalrad plan into effect. As soon as possible, the participating AM stations will return to the air on the approved maximum power and broadcast vital information and instructions to the public on the Canalrad frequencies of 640 or 140 kilocycles FM, and TV stations will remain off the air for the duration of the radio alert. After the Canalrad radio alert has been terminated by the NORAD commander, civil authorities will use all surviving civilian-owned means of broadcasting, calling on military communications support if necessary. The priorities of use in emergency. Instructions and information relating to measures to support military operations and to save life have priority over all other information and instructions. G. Maintenance of government, law and order in one state and local. A local government is the basic entity responsible for the emergency maintenance of law and order. The state law enforcement forces will support local police services in emergency as the situation allows. States will exercise general control and provide services in areas where the local government is unable to act. Requests for additional police support will not be made to the federal government until state and local police are or are expected to be inadequate to cope with the situation. Federal, upon request of the state government, or an event the state government with unable to act, the federal government will assume and exercise all necessary government functions during an emergency in areas where it is determined that government organizations have been rendered incapable of performing vital functions. Be upon request, the Secretary of Defense will provide emergency military aid to the civil authority to assist in the maintenance of law and order, to the extent that such commitment will not interfere with the conduct of primary military missions. Federal agencies having responsibilities for performing or assisting in the performance of state and the local government functions will be familiar with the performing state and local plans. Disaster services. States and their political subdivisions, with the financial and technical assistance of the federal government, will accumulate necessary supplies and equipment and recruit and train personnel in disaster services. The federal government will acquire and store limited quantities of supplies and equipment for disaster service operations as a general reserve disaster service and include, but are not limited to, a casualty care and emergency public health 20, the emergency welfare services 21, rescue, day debris clearance, Emergency procedures. A state and local governments will direct vimificant populations away from danger areas, commit disaster forces under their control as required by the situation, evaluate their capabilities, and notify the state of deficiencies or excess capabilities in accordance with prearranged state and national plans. Notification may also be made to the field offices of appropriate federal agencies. Due consideration will be given to the continuing requirements for disaster services. In emergency commitment actions, the state, in turn, will evaluate the total situation within the state, direct the movement of populations away from the danger areas, and commit state disaster forces, including those made available by invocation, and commit to state compacts as indicated by the situation. Field offices of appropriate federal agencies will assist the states in providing disaster services. States will also use, where appropriate, resources of non-governmental organizations such as the American National Red Cross, the American Medical Association, and the American Hospital Association. When state capabilities are deficient, requests for needed support will be made to the OCDM Regional Director. Capabilities access to the needs of the states will also be reported to the regional director when requests